Suicide among American Indian and Alaska Native youth through the lens of cultural context, access to mental health services, and resilience factors. Through this Photo Voice project, we aim to visually depict how the environment, culture, geographic isolation, and support systems can shape the experiences of American Indian and Alaska Native youth, particularly in rural California communities. The images throughout this presentation are meant to highlight both the challenges and the strengths present within these communities while emphasizing the importance of culturally grounded strategies to mental health and suicide prevention. Hi. As we begin this Photo Voice project, it is important to recognize that suicide among American Indian and Alaska Native youth is connected to more than mental health alone. For many rural California communities, factors such as isolation, limited access to behavioral health services, and the lack of culturally responsive care can shape how support is received and whether it is accessible at all. This image reflects both the beauty and the isolation that can exist within rural communities. While these environments can foster strong cultural identity and connection to land, they can also create barriers to healthcare access and crisis support. At the same time, this image is not only meant to represent struggle, but also resilience, as community, culture, family support, and identity continue to serve as important protective factors for many American Indian and Alaska Native youth. Through the following slides, we will explore how cultural contexts, mental health access, and resilience factors all interact in shaping the experiences of American Indian and Alaska Native adolescents today.
One major issue affecting American Indian and Alaska Native youth is geographic isolation. About 22% of Native individuals live in rural areas where behavioral health services are limited or difficult to access. This means many families must travel long distances to reach hospitals, counselors, or crisis intervention resources. In counties like Stanislaus, transportation barriers and provider shortages can delay critical mental health support. When youth face these obstacles, it can increase feelings of isolation, reduce access to prevention services, and contribute to higher suicide risk.
While colonization and forced relocation disrupted indigenous families, traditions, and healing systems, both culture and community continue to serve as great sources of resilience. Historically, many indigenous communities experienced the loss of language, separation of families through boarding schools, and the suppression of traditional healing practices, all of which contributed to long term mental health disparities and intergenerational trauma. Today, many American Indian and Alaska Native youth still face barriers to receiving culturally responsive mental health care, especially in rural communities where behavioral health providers are limited and culturally specific services may be unavailable. Research has also shown that indigenous populations remain underrepresented in the mental health workforce, which can make it more difficult for youth to receive care that reflects their cultural experiences and identities. These disparities are reflected in suicide related behaviors among American Indian and Alaska Native adolescents. Across surveyed years, American Indian and Alaska Native adolescents average approximately 1 in 4 contemplating suicide, 1 in 5 planning suicide, and 1 in 6 attempting suicide. At the same time, studies have found that protective factors such as family, connectedness, positive adult relationships, community support, and involvement in traditional cultural activities can help strengthen resilience among American Indian and Alaska Native youth. The following image reflects those protective factors through community gathering, cultural participation, and collective support. Rather than focusing only on risk, it also demonstrates how cultural identity and community connection can promote healing, belonging, and resilience among American Indian and Alaska Native youth.
Further going into access to services, as we know, many Native Indian and Alaska Native reside in remote areas, which restricts them from accessing resources crucial for suicidal prevention. These include hospitals, mental health care facilities, and behavioral health clinics, making it challenging for youth and families to obtain timely support. Data also shows that in many Native serving healthcare systems, there is a lacking of funding and understaffing, which leads to long wait times and limited availability of counselors, social workers, and psychiatrists. Research also shows that in many communities there are only small numbers of mental health providers serving large populations across multiple rural areas. This, as a result, contributes to more suicides among these communities as services are either limited or not at a certain condition in which helps young Native Indian and Alaska Native adults. Another service that Native Indians and Alaska Natives are restricted from would be internet access, as internet access allows for more than just education, but opportunities to access telehealth and online counseling services, which can help reduce or prevent suicide. Education and counseling. It is determined that many educational inequalities can increase feelings of isolation, hopelessness, and reduce future opportunities among American Indians and Alaska Native youth. Lack of counselors and unfunded schools amongst American Indians and Alaska Native youth communities can lead to lack of adult support, connectiveness among peers, and higher cases of suicidal attempts. Study shows that within American Indians and Alaska Native youth communities, many show suicidal thoughts and behaviors. A research report was conducted and it found that required suicide prevention training for school staff does not necessarily lower suicide rates. Such training is meant to help identify students who may be struggling in order to prevent suicide. The report also showed that many students either feel labeled or stigmatized and experience anxiety or are referred for support even when they may not actually be at risk. At the same time, some students who truly are in need may still go unnoticed. The overall conclusion of this research report was that suicidal prevention programs and systems should be implemented early on within education and should focus more on support systems rather than prediction and assumption.
Overcrowded housing conditions can make it difficult for youth to find privacy, rest, or emotional space. When multiple family members share small living areas, stress and conflict may increase, especially during periods of financial hardship. For American Indian and Alaskan Native youth, these environments can contribute to emotional exhaustion, social withdrawal, and difficulty coping with mental health challenges. Stable housing and supportive community environments are important protective factors. Economic instability in the Central Valley is often tied to seasonal agricultural work. For many families, income changes throughout the year depending on harvest cycles and available labor. This financial uncertainty can increase stress within households and affect youth mental health by creating insecurities around housing, food, and daily needs. For American Indian and Alaskan Native youth, these pressures can contribute to anxiety, hopelessness, and increased suicide risk.
One of the biggest challenges facing Native youth is that many communities still do not have enough mental health resources or funding. Tribal programs are often underfunded, and in many rural areas, there are not enough counselors or support services available. This can make it difficult for young people to get help early, especially when they're already dealing with stress, trauma, or isolation. When support systems are limited, mental health struggles can go untreated. Improving funding and expanding culturally supportive services could make a major difference in prevention and long-term well-being. Substance use can become a serious risk factor for Native youth who are already facing trauma, stress, or limited access to mental health support. In some communities, alcohol or drug use may be used as a way to cope with emotional pain, but it can often worsen mental health struggles over time. Substance misuse can increase depression, risky behaviors, and suicide vulnerability. Expanding prevention programs and treatment resources is important for supporting healthier coping strategies and long-term well-being.
As we conclude this Photo Voice project, it is important to recognize that the experiences of American Indian and Alaska Native youth are shaped by both ongoing challenges and continued resilience. The research presented throughout this project highlights how historical trauma, rural isolation, limited behavioral health infrastructure, and barriers to culturally responsive care continue to affect many American Indian and Alaska Native communities today. American Indian and Alaska Native adolescents continue to experience some of the highest suicide disparities in the United States, with suicide rates reaching 18.95 per 100,000 youth. Research also found that approximately 1 in 4 American Indian and Alaska Native adolescents reported seriously contemplating suicide, with 1 in 5 reported making a suicide plan, and 1 in 6 reported attempting suicide. In addition, American Indian and Alaska Native adolescents were found to be approximately 2.5 times more likely to attempt suicide compared to their non-Hispanic white peers. Additionally, the images and research throughout this project also demonstrate the importance of resilience factors such as cultural identity, family support, community connectedness, and traditional practices. These factors continue to serve as important sources of healing, belonging, and emotional wellness for many Indigenous youth. Moving forward, suicide prevention efforts must go beyond crisis intervention alone by improving access to culturally responsive mental health care, expanding behavioral health resources in rural and tribal communities, and supporting Indigenous-led approaches to healing and prevention. By recognizing both the disparities and the resilience present within American Indian and Alaska Native communities, we can better support long-term mental wellness and hope for future generations.